We've always had a really close relationship with Ronald McDonald House Charities, and it was several years ago that we had this formal partnership to go in on the Ronald McDonald Caremobile together.
The partnership between Parkview and the Ronald McDonald House is wonderful. We need each other to complete the whole care for the family unit, from the child to the parents to the siblings.
Parkview, as a not-for-profit hospital, gives a large percentage of their earnings back into the community, and we invest that in a number of ways.
We are in Fort Wayne, Indiana, on the Ronald McDonald Caremobile. We see a lot of people interested in seeing what this Caremobile is about. They are reading the signs, looking at the pictures. On occasion, usually for little kids, doing the pull-down signal, I'll give them the old horn.
The Caremobile serves a population of children between the ages of 0 and 18. And we're looking for those uninsured, underserved families that may not get their child to health care otherwise.
But we really want to be there for anybody who needs it. So that may be a working parent that can't get off during the day, and the Caremobile partners with their school, and that's a way that their child can access it.
I go and pick up the vaccines at a local clinic for Parkview, and then our site coordinator has a location arranged for us. We are on our way to an elementary today to see some children that will be coming out of the school that need some wellness checks or vaccinations. And we see as many children as possible that are in need of some health care.
The team that works on the Caremobile is so unbelievably compassionate and empathetic. They are truly led by their hearts and dedicated to this work.
Whether they are trying to level the Caremobile on a playground, whether they are actually caring for a child, whether they have found a diagnosis and to have to deliver that news to the family unit, they want to be there. They're specifically looking to help these families improve, and that really makes a huge difference.
Dia is unbelievably proactive. She wears a lot of hats. She's the driver, she does all of our check-in, and she really supports the team.
Chloe, she's a quiet force, but Chloe is there to ensure that all the details get done.
Chloe is our medical assistant, checking blood pressure and temperature, height, weight, asking the questions that need answered.
Angie is just very in tune and caring and approachable. She does everything on that mobile unit that you can get in a regular pediatric office. So she could do physical exams, well child visits, acute care, sick care, oral health, vaccines, lab tests, really anything that you need we can do on that bus.
When you combine these three together, that's why the Caremobile is effective.
It's like a family.
Yeah, in a small space.
In a very small space, yes. We have a good time together. It's easy access to healthcare. We're trying to make it as convenient for a family as possible. Being in their neighborhood, making it easy when they're dropping their kids off to school, things like that.
Getting awareness out of the Caremobile, letting the communities and the parents know, and them feeling secure enough and confident to let their children come to the Caremobile and get the health care that they need.
There is fear from some of these parents coming to the Caremobile, whether they're going to be accused of something, whether they're in trouble for not getting health care for their child. That doesn't matter. Just like the Ronald McDonald House, everybody is welcome on the Caremobile. We just want to serve these families.
I share a little bit about my kids and my kids' experience, and kind of just making it easier for them to feel comfortable that I know what I'm talking about, So yeah, but the interactions is the best, and the kids' smiles.
It's definitely a blessing to know that we're making a difference in so many people's lives.
Without the Caremobile, many of these families would continue to utilize the ER for basic care. Many of these children would go without having immunizations. Having a trusted healthcare provider is a wonderful way to prevent the high cost of an unnecessary ER visit.
You know, we can look at how much a doctor's visit cost or how much albuterol cost, but I think it's way beyond that. We are hopefully saving medical bills from everything from child obesity to infant mortality way down the road, and I think it's hard to put a price on that.
The goal of the CareMobile is not necessarily to be the child's long-term medical home.
Our goal is to see them and then connect them to longer-term medical care. We're concerned about their future. That's why we're there.
Angie can meet them, help build the trust with the family, and then help introduce them to another provider within the community to do that long-term care. And so it's kind of a safety net, if you will, to really catch a lot of those folks that would maybe fall through the cracks.
We had a wonderful, productive day today. We were able to get some immunizations done for the children and also a couple physicals so that they could start daycare.
Building these relationships, it really is putting a lot of these children on the right path to lead a healthy life that they may not have had that opportunity without this.
We're not just there to treat a child one day and go away. We are there to treat a child, ensure that they have future care, and ensure that that future care changes that child's future, which ultimately changes our community. This is not a job. This has become a personal mission for all of us.